Hello, good day everyone. I am Guadalquiver from BSN 12L Group 46, and so for today I'm going to perform a proper demonstration about the parental medication administration. So the parental medication administration consists of the intravenous, the intradermal, the intramuscular, and the subcutaneous. However, in this return demonstration, I'm going to perform intradermal. So intradermal medication is used for skin testing and tests for tuberculosis. And also, this medication enters to the body through the capillaries and the circulatory system. So first and foremost is we need to check for the doctor's order. Next is we need to check for the medication administration record. Next is we need to check for the label of the medication carefully against the EMAR. This is to ensure that the right medication is being prepared. And also, follow the 3 checks in administering medications. Read the label of the medication. First is we need to, when it is taken from the medication cart. Second is before withdrawing the medication. And third is after withdrawing the medication. And also, organize all the equipment to be needed. So, we have the syringe. We also have the sterile water, which will serve as our improvised ampule and vial since there is no available on the pharmacy. And also, we have the cotton ball soaked in a cleansing solution. We also have the gloves and also the waste receptacles. And also, don't forget to perform hand washing and hand hygiene in order to deter the spread of the microorganisms. So now we are going to prepare the medications from vial. So first is prepare the medication vial for drug withdrawal. Next is mix the solution if necessary by rotating the vial between the use of the palm of the hands by not shaking. Now, remove the protective cap or clean the rubber cap of a previously opened vial with an antiseptic wipe by rubbing in a circular motion. And discard the cotton ball. And now, withdraws the medication. Attaches a filter needle as agency practicing paste to draw up pre-mixed liquid medications from multi-dose vials. Ensure that the needle is firmly attached to the syringe. Now, remove the cap from the needle, then draw up into the syringe the amount of air equal to the volume of the medication to be withdrawn. Carefully insert the needle into an upright vial through the center of the rubber cap, maintaining the sterility of the needle. Inject the air into the vial and keeping the bevel of the needle above the surface of the medication. And withdraws the prescribed amount of medication using either the following methods. So we have holds the vial down with the base lower to the top and move the needle tip so that it is below the fluid level and withdraws the medication. And also inverse the vial, ensure that the needle tip is below the fluid level and gradually withdraw the medication. And now cover the syringe with the needle cap.
So you already close the door, fix the curtains, adjust the room temperature, and provide adequate lighting for my patient's comfort and privacy. Hello ma'am, good day. How are you feeling today? Okay, great. So it is important to read the client in order to establish a clear rapport between the healthcare provider and to the patient. So ma'am, let me introduce myself to you. I am Guadalquiver and I am your student nurse for today. So may I know your full name please? When is your birthday? How would you like me to call you? Okay, great. So ma'am Jenny, the procedure that I'll be doing is I'll be administering you a intradermal medication. So intradermal medication is administered through your dermis, which is a layer of your skin. And also this medication will create a small wheal or sometimes called bleb. So this wheel is a small raised area like a blister. And also there are certain procedures that we need to follow. Is that okay with you, Ma'am Jenny? Any concerns or any questions? Okay, great. So it is important to explain the procedure of the assessment to the patient so that they will know how can we participate on the assessment.
Now, select and clean the site. Select a site, the forearm above the hands with above the wrist and 3 or 4 fingers. Avoid using sites that are tender, inflamed, or swollen, and those that have lesions. Apply gloves as indicated by agency policy and cleanse the skin at the site using a firm circular motion. And discard. So now, prepare the syringe for injection. Remove the needle cap while waiting for the antiseptic to dry. Expel any air bubbles from the syringe, and small bubbles that adhere to the plunger are of no consequences. And grasp the syringe in your dominant hand close to the hub, holding it between the thumb and forefinger. Hold the needle almost parallel to the skin surface with the bevel of the needle up. And inject the fluids. With the non-dominant hand, pull the skin at the side until it is taut. For example, if using a ventral forearm, grasp the client's dorsal forearm and gently pull it to tighten the ventral skin. And insert the tip of the needle enough to place the bevel through the epidermis into the dermis. And stabilize the syringe and needle and inject the medication carefully and slowly so that it produces a small wheal on the skin. And adjust the needle quickly at the same angle at which it was inserted. Activate the needle safely device and apply bandage if indicated. Do not massage the area and remove and discard the gloves. And perform hand washing and hand hygiene. And circle the injection site with aim to observe the readiness or induration per agency policy. And evaluate the condition of the site 30 minutes depending on the test. Measure the area of redness and induration in millimeters at the largest diameter on the document findings.
So now, document all the relevant information, including the time of administration, drug name, dosage, and the route, including the client's reaction. And now, assess the effectiveness of the medication as it is expected to act. And that's it. That's my proper demonstration about the parental medication.